Causes and treatment of cough. Causes of cough. A cough is a reflex action that helps clear the airways of mucus, irritants, or foreign particles. It can be caused by various factors, including 1. Viral infections. Common colds, flu, and COVID-19 can cause temporary coughing due to throat irritation. 2. Bacterial infections. Conditions like pneumonia, bronchitis, or whooping cough, Bordetella pertussis, can lead to persistent coughs. 3. Allergies. Pollen, dust, pet dander, and mold can trigger an allergic cough. 4. Asthma. Chronic cough with wheezing is a common symptom of asthma, especially at night or after exercise. 5. Acid reflux. GERD, stomach acid can travel up into the esophagus, causing irritation and coughing. 6. Smoking. Long-term smoking irritates the lungs, leading to a chronic cough, smoker's cough. 7. Environmental irritants. Exposure to pollution, chemicals, or strong odors can cause coughing. 8. Postnasal drip. Excess mucus from sinus infections or allergies can drip down the throat, causing a cough. 9. Lung diseases. Chronic obstructive pulmonary disease, COPD, tuberculosis, TB, or lung cancer can lead to prolonged coughing. 10. Certain medications. Some drugs, such as ACE inhibitors for high blood pressure, can cause a persistent dry cough. How to cure a cough. The treatment for a cough depends on its cause. Here are some effective ways to relieve and cure coughing. 1. Stay hydrated. Drink plenty of warm fluids like water, herbal tea, or honey lemon tea to soothe the throat. 2. Use a humidifier. Adding moisture to the air can prevent throat dryness and irritation. 3. Gargle with salt water. This helps reduce throat inflammation and kill bacteria. 4. Take cough syrup or lozenges. Over-the-counter cough medicines like expectorants, to loosen mucus, or suppressants, to reduce dry cough, can help. 5. Rest and get enough sleep. Allow your body to recover by getting proper rest. 6. Avoid smoke and pollution. Stay away from cigarette smoke, dust, and other irritants. 7. Try honey and ginger. Natural remedies like honey, ginger, and turmeric can help soothe the throat and reduce coughing. 8. Treat underlying conditions. If the cough is caused by asthma, allergies, or acid reflux, managing these conditions can prevent persistent coughing. 9. Steam inhalation. Inhaling steam with essential oils like eucalyptus can help clear congestion and relieve cough. 10. Consult a doctor. If the cough lasts more than 3 weeks, is accompanied by fever, blood and phlegm, shortness of breath, or severe chest pain, seek medical advice immediately. By following these steps, most coughs can be effectively treated. However, prevention is always better than cure. Maintain good hygiene, avoid smoking, and stay away from potential allergens to keep your respiratory system healthy.